Good afternoon, everyone. This is Dr. Rekha G Dietitian, Oasis Fertility Center, Bengaluru. Today's topic for the Facebook Live is micronutrients and fertility. Welcome all of you to the Facebook Live program. So let us know about micronutrients and fertility. Let us know step by step what are micronutrients and which are the things which are included in micronutrients category, and about the fertility and infertility, and how micronutrients and fertility are related to each other. Means how they will affect on each other like that. So let us know all these things one by one. First, let us know about the micronutrients. What are these micronutrients? Micronutrients are the nutrients which are needed by our body in a very small amount. For example, in micrograms, milligrams, and international the weight is assessed in international unit. So these micronutrients are vitamins and trace elements like minerals. These are included under micronutrients. These are micronutrients are the nutrients. These nutrients. Let us know about the nutrients. What are these nutrients? Nutrients are the part of the food what we intake. So this will act. This will be needed. These micronutrients are needed in very small quantity, and they will help in many of the body functions like all the enzymatic activities, hormonal functions, and many other neurological functions are governed by these micronutrients. And also these acts as a cofactor in many of the biological processes. So these are very much needed by our body, even though they won't provide any energy to the body, but indirectly they will help in providing proper energy to the body. And when there is a deficiency of these micronutrients, that will definitely going to cause many of the health issues, many of the lifestyle disorders, and many of the non-communicable diseases, NCD kind of diseases. All these are due to the nutritional deficiencies. So, in some cases, it may result in very fatal things. Results in many of the adverse effect on the body, and it may lead to death also. So, these micronutrients play a major role in the overall health of our body. So, we have to take it in a judicious way so that in order to balance all the functions in our body. Majorly iron deficiency, vitamin A deficiency, selenium deficiency, and vitamin D deficiency are most common among the population. So we have to this can be well maintained by having a proper balanced food. So these are about the micronutrients. So let us know about what is fertility and what are causes for infertility and these things. So fertility is the capacity of producing a clinical pregnancy. This is called as fertility. If there is, according to WHO, infertility is said as it's a form of disease of the reproductive system, which will even in the unprotected regular intercourse for a period of 12 months, they can't produce clinical pregnancy. This has become a major issue nowadays in the world. So throughout the world, around 12% of the people who are in reproductive age are suffering from infertility. Nearly 18 million people are affected with this. So infertility is not only related to female; it's both in male also. We are seeing nowadays it has become more prominent. So around 10 to 20 to 30% of male infertility is there. When it comes to women, 20 to 35% of infertility is there. Combined means both male and female infertility is about 30 to 40%, and 10 to 20% of infertility is from unknown cause, that is iatrogenic causes. So we have to give much importance. We have to know different aspects of the infertility, so that based on that we have to treat the conditions. So the micronutrition also play a major role with respect to fertility. So through many of the control studies, it has been proved that micro deficiency of many of the micronutrients like zinc, selenium, vitamin D, these are and many more micronutrients, and vitamin B6, B12, B9. These deficiencies or they impair levels in our body will lead to infertility in many of the people. These data are collected from controlled studies. So we have to rely on that, based on that. So let us see some of the micro nutrients which are responsible for the fertility. First one is zinc. Zinc is very much important in both male and female infertility, of fertility with respect to male and female fertility. So zinc is very much important for spermatogenesis and the sperm motility and the sperm concentration also. This plays a major role with respect to male fertility. And also in female, it is very much important when it comes to the quality of the oocyte. The growth, proper quality of the oocyte is governed by the percentage of zinc level in the bloodstream. And it is also very much important for many of the function related to ovulatory functions, and helps in maintenance of the menstrual cycle. In the same way, other micronutrients like selenium are very much important with respect to fertility. Their deficiencies lead to many of the complications, and also especially the testosterone level will be impaired with the deficiency of selenium. And also selenium acts as zinc and selenium both acts as antioxidants. They play both the roles, antioxidant and also as a micronutrient. So these two are very much important with respect to male and female infertility. Likewise, iron, folic acid, that is vitamin B9, folates, these are very much important with respect to fertility. When it comes to pregnancy, the folate deficiency leads to many of the complications like neural tube defect, premature birth, stillbirth, and also many of the other complications like during the pregnancy. And many of the neurological problems will be there in the after the childbirth, and these deficiencies will definitely going to affect the baby also. If that lady has delivered a baby, this micronutritional deficiency, that will also affect the growth, the proper growth of the baby. This may be the premature birth weight is there. So it will lead to many of the complications in further. So likewise, in this way, these micronutrients play a major role with respect to fertility. So there are also many other anti-nutrients which affect the absorption of micronutrients. So we have to know about all those things also. So what are those anti-nutrients? Let us know one by one. Those are alcohol consumption. Nowadays, many of the people they have habituated to alcohol consumption, both the female, male and female. This will affect their fertility very much because this will affect the absorption of these micronutrients in proper way. In turn, it affects in the fertility. So the alcohol consumption it will disturb the gastrointestinal tract, affecting the gut health, which in turn it leads to impaired absorption of the micronutrients. Even though we are taking a well balanced and nutritious food, also if the gut health is not maintained properly, it will lead to micronutritional deficiencies. So we have to concentrate on that. Alcohol consumption has to be reduced in order to get a good gut health and in turn for the proper micronutrition supplied to our body. And also smoking causes oxidative stress in the body. What is this oxidative stress? Let us know. This oxidative stress means when even this oxidative stress is the oxygen which is in the body, which has free electrons. Outer orbit of the atom of the oxygen will have a unpaired two unpaired electrons. So this is the main culprit which causes oxidative stress in the body. These oxygen are very highly active. If it is not suppressed, if it is not neutralized properly by the body, this will lead to many of the conditions like degenerative conditions in the body. For example, if it is gets settled, these highly reactive, active oxygen settled in the eyes, it may lead to cataract formation, glaucoma, and many of the other eye conditions. In the same way, when it gets settled in the reproductive system, it will affect all the functions of the reproduction, and it will destroy the cells even in the male and female. The cells of the reproductive organs, the testicular cells and endometrium cells lining and ovulatory ovum and sperms are get affected with the excessive oxidative stress. This can be balanced only by including antioxidant in our day-to-day means in our balanced meal plan. So our body has its own antioxidants which are produced in our body. Those are glutathione peroxidase and acanthases. These are the antioxidants which are produced in our body. These will help in the neutralizing these highly active oxygens. So this will help in maintaining the oxidative stress in the body. These internal antioxidants are very much needed, and they will perform their function. Even though when there is a high oxidative stress in the body, externally we have to provide some of the antioxidants. So these many of the vitamins like vitamin A, vitamin E, vitamin D, vitamin C, these play a role of antioxidant. Along with that, trace elements like zinc, selenium, these will also act as antioxidants. So we have to provide all these things to our body in a proper way so that it can reduce the oxidative stress and helps for the proper flourishing of our body. So and also maintaining many of the conditions in the body. So most of all the diseases are due to the degenerative disease are due to the oxidative stress only. So we have to concentrate on each of these things. So it has to be taken in a very balanced way. So for example, if it is not taken in a proper way, this will lead to many of the conditions. If If the nutrients are taken in higher quantity also, that will going to affect our body. For example, if the iron intake or the folate, their deposition are very normal, higher than the normal requirement, that will also affect. This will get deposited in the tissues, the reproductive tissues, for example, in the testicular tissues, and affects in the spermatogenesis. So in this way, it is going to affect. So it has these micronutrient has to be taken in a proper way. If there is if you want to take any supplement, if there is a need of any supplementation when there is a deficiency of these micronutrients, so we have to consult proper registered health professionals so that they will guide in a proper way so that these micronutrients can be balanced in our body. Yeah, in this way, these micronutrients affect the fertility and other things. How we can balance these micronutrients in our body. This can be done with proper balance intake of proper balanced diet, so that it will include all the things in that packaged form. There is because the food which are available, what we are taking, it will be having all the nutrients in different proportion. So we have to make a proper combination of the things so that it not only balances macronutrients, along with it helps in balancing the micronutrients also. So we have to include proper carbohydrate, protein, and fat along in the food what we take. Along with it, it will helps in maintaining these micronutrients also along with that. So a proper, well-balanced diet is very much important with respect to in order to maintain the micronutrients, balance of the nutrients in our body. So if there is a imbalance, if there is a deficiency of any of these things, that can be properly supplemented with supplementations. So that has to be taken with the guidance of proper healthcare professional. In this way, this can be maintained. Along with that, for the proper absorption of these micronutrients from the body, we have to include good amount of physical exercises so that it helps in the proper absorption of these nutrients. Now, last but not the least is we have to maintain the stress level so that it is very much important, because as the stress level increases, it will definitely going to increase the oxidative stress in our body, which in turn lead to many of these conditions, and that will definitely going to affect the fertility. So proper stress management is very much important. Not only with respect to have a proper health, it also helps in very much important with respect to fertility, because those who are suffering having this condition, infertility issue, they will be having so many of psychological stress. It may be external or it may be internal. So, if they are not maintaining this stress factor, that will definitely going to affect on the body, and it will affect their health, gut health, especially gut health, which will disturb which will impair the absorption of these micronutrients from the food what we take. So we have to concentrate on each and everything in our daily routine. So then the thing is that we have to maintain a proper lifestyle. That is the main thing. Lifestyle includes all the diet, exercise, the sleep pattern, and the timings that should be there. Proper timing of the meal. These are the things we have to maintain. Then only it will help in the proper absorption of these micronutrients in a proper way in our body. In this way, it is going to the micronutrients going to affect the fertility. Thank you.